Alberta. With us today is Dr. Deena Hinshaw, Chief Medical Officer of Health for Alberta, and Dr. Verna Yiu, President and CEO of Alberta Health Services. Dr. Hinshaw and Dr. Yiu will provide brief remarks, and then we will open the floor to questions. I will now turn it over to Dr. Hinshaw.
Thank you, Lisa, and good afternoon, everyone. Before I begin today's COVID-19 update, I'd like to address a question we've heard around a small update that we've made recently to the daily checklist. As you know, we have continually updated the daily symptom screening checklist to align with public health recommendations and orders as they evolve. In the latest version, we added the recommendation that when someone tests positive, any unvaccinated and partially vaccinated household contacts should quarantine for 14 days after an exposure to a COVID case in their household. While quarantine is not legally required at this point in time, we wanted to be clear that we strongly recommend that all household contacts who are not fully immunized stay home for 2 weeks after they were exposed. This is because living in the same home as someone with COVID puts you at the highest risk of becoming infected and further spreading the virus to others. I know this may be of particular impact to schools and childcare settings, as children under 12 are not able to be immunized. I also know that this may be inconvenient for those we are recommending to stay home. However, at the current time, we believe that after a household exposure specifically, anyone not protected by 2 doses of vaccine should stay home and away from others to limit the risk of onward transmission. To be clear, this is household close contacts only, not other close contacts such as classmates in school or a workplace. There are other health measures already in place for these settings, such as distancing, masking, and a working from home policy for workplaces. Turning to today's update. In the last 24 hours, we have identified 1,660 new cases and completed about 18,000 tests. Our positivity rate was about 9.4%. Currently, 1,058 people are being treated for COVID-19 in hospital, including 226 in the ICU. 100% of new ICU admissions were in Albertans who did not have any vaccine protection. Sadly, I must announce that 17 new deaths were reported to Alberta Health in the last 24 hours. My condolences go out to the loved ones of these individuals and to all who have lost a family member or friend to any cause during this pandemic. As with the deaths reported earlier this week, while a small number of these individuals were double vaccinated with pre-existing health conditions, most were not vaccinated at all. Vaccines are safe, effective, and they save lives. It's important for all of us to do our part to protect those who are vulnerable. I know that many parents are eager to have their children under 12 vaccinated, and as I said on Tuesday, we are watching the evidence closely. While we have seen an increase in young people diagnosed with COVID during this wave, to date we have not seen an increase in the proportion of children who are experiencing severe outcomes from COVID. This is not to minimize the fact that young people still face some risk, but it is another reminder that by lowering transmission in all ages, and by those who are eligible getting vaccinated, we can help protect those who aren't yet old enough to access vaccine. Every Albertan turning 12 this year or older has been eligible to be vaccinated for about 4 months now, and I cannot stress enough the importance of making this choice to protect you, those around you, and our healthcare system. Vaccines remain one of our most powerful tools in the fight against COVID-19. That's why today I would like to highlight once again some of our key data. Albertans who have not been fully vaccinated are about 15 times more likely than unvaccinated Albertans who have not been fully vaccinated are about 15 times more likely than those with vaccine protection to end up in the hospital from COVID-19. They are about 40 times more likely to be admitted to the ICU. About 77% of Albertans in hospital with COVID are not fully vaccinated, and 92% of those in the ICU right now have not had both shots. We have heard persistent questions and rumors on social media that vaccines are not working against the Delta variant, but this is categorically untrue. In Alberta, COVID-19 vaccines have proven to be 85% effective against infection with the Delta variant after 2 doses. COVID-19 vaccines are even more highly effective at preventing severe disease and death, including against the highly contagious Delta variant. The bottom line is that 2 doses of vaccine will protect most people from getting sick, having to go to the hospital, or dying if they catch the virus. However, no vaccine is 100% effective. A very small percentage of fully vaccinated people could still get COVID if they're exposed to the disease. These are called vaccine breakthrough cases, and although the risk of severe illness is much less in these cases, it is important to remember that some people have conditions that mean their body cannot fully respond to doses of vaccine. That's why preventing these breakthrough cases requires the rest of us to participate in forming a protective shield around them, and may necessitate a booster for some individuals, which is why we expanded criteria for immunocompromised eligibility earlier this week. Please, if you are not yet fully vaccinated, do so as soon as possible. I also encourage you to help others who may need help finding reputable sources of information on COVID vaccines, or those who need help making or getting to vaccination appointments. I also know there have been many questions about immune response from prior infection. Some people are wondering if they need a vaccine if they've already had COVID-19, and whether having recovered from infection should make them exempt for the restrictions exemption program. At this time, everyone needs proof of vaccine or a recent negative result on a privately purchased test or a medical exemption in order to enter businesses in the restrictions exemption program. The bottom line is that my advice for those who have had COVID-19 remains the same. It is still best for everyone to be fully vaccinated with 2 doses to obtain the greatest possible protection from infection. It's also important to remember right now that with our current high levels of transmission, there is still some risk that anyone, whether or not they have recovered from a previous COVID-19 infection or have received immunization, could possibly be reinfected and potentially transmit COVID-19 to others who may be vulnerable to severe outcomes. That's why masking in indoor public places and staying at home if feeling ill is mandatory for everyone in all areas of the province, and I encourage getting tested if you are showing COVID-19 symptoms. Finally, on the topic of post-infection immunity, I want to speak about an event that is being reported in the news. While I have not received confirmation that this event took place, reports began circulating yesterday of an event where several people are said to have gathered in a deliberate attempt to acquire COVID-19 in order to develop post-infection immunity. It is being reported that several of these individuals ended up in hospital and in already crowded Edmonton ICUs. Again, I cannot confirm that these reports are accurate, but whether or not this specific report is verified, what is important to know is that anyone contemplating this kind of activity should know that this consequence, severe illness, and transmitting to others who may become severely ill or even die, is an absolutely likely outcome. Hosting or attending an event like this in the current time of crisis is irresponsible and dangerous. It doesn't just put you at risk, but those around you, including people who may need health care for other reasons than COVID, but have no critical care capacity available for them when they need it. If anyone wants to get protection from infection, vaccines are free, highly effective, and easily available. The safest and best way to reach herd immunity for Albertans is to be vaccinated, plain and simple. We need each other more than ever right now. and making choices to keep family, friends, and communities safe from the impacts of COVID-19 is life and death work that requires all of us. Thank you, and I'll now invite my colleague, Dr. Yiu, to update you on our healthcare system.
Good afternoon. Before I begin, I want to take a minute to express my deep condolences to those who have lost a loved one during this exhausting pandemic. We've seen a number of deaths due to COVID-19 increase significantly during this fourth wave, a sad reminder to all of us that this virus is deadly, particularly to those who are unimmunized. Every day we see the numbers. There are people behind the numbers. They are spouses and partners, grandparents, uncles and aunts, sons and daughters. They are people's best friends and loved ones. The other people that I think of regularly are those Albertans who have been impacted by our decision to postpone surgeries. Having your surgery delayed can be extremely traumatizing, particularly if you've been waiting a long time, and especially if your surgery is potentially life-changing. Delaying surgeries is not something that we ever want to do. But unfortunately, right now, it is necessary to reduce the pressure on our ICUs. We are deeply sorry to all Albertans who have been impacted by this. I wish that we were not in this position, and my heart goes out to all of you. Our hospitals, and in particularly our intensive care units, continue to experience unprecedented patient demand. As of early afternoon, there are 310 Albertans in ICU, of which 226 patients have COVID-19. We have never ever had that number of total patients in ICU before, never with the prior waves and never in the history of this province. And each day we see a new high. Yesterday alone we had 22 Albertans who were admitted to our ICUs with COVID. The day before, we had 23. And over the past 5 days, the average number of COVID ICU admissions have been more than 23 per day. It's tragic that we are only able to keep pace with these sort of numbers because, in part, some of our ICU patients have passed away. And this reality has a deep and lasting impact on our ICU teams. With that in mind, I should also note that in the past 2 days, our teams have managed to move 18 patients out of ICU, which means that these patients no longer need that critical level of care and are hopefully on the long road to recovery. We are facing a fragile balance. On some days, we are seeing more ICU patients than admitted, than new ICU beds being created. We are transferring more patients out of zones to zones where there is additional critical care capacity. Our incredible physician staff continue to do amazing things in order to allow us to increase capacity and to meet the demands and needs of our patients. As of noon today, we have 350 ICU beds across the province, which keeps our ICU capacity at 89%. We have added 177 ICU surge spaces, which means that we have more than doubled our baseline of ICU beds. And without those additional beds, our capacity would be at 179%. Creating capacity is not a simple task, and the beds we have added are not standard ICU beds. In fact, nothing is really standard about the situation right now, including staff ratios and some of the patient care we are providing outside of our ICUs. But this is the reality of our current situation. We have to do things differently to ensure that we can care for all patients. However, I want to reassure people that safety remains at the forefront of all our decisions. My commitment to you is that we will continue to do everything possible to care for Albertans, and that commitment will never waver. I'm pleased to see that so many Albertans are getting immunized against COVID-19 in the past week. I'd like to thank all of you who have taken this important life-saving step And I strongly encourage and urge all of you who have not been immunized to get immunized as quickly as possible. Please, if you have any questions or concerns about the vaccine or its effectiveness or how safe it is, please reach out to a healthcare professional or call 811 or visit the AHS website. There's a lot of misinformation out there, and it's important to get the facts. Sadly, we're definitely seeing an increase in cases in children ages between 10 and 19 years of age. It is clear that the Delta variant is much more virulent than previous variants of concern, and that it has impacted younger people at higher rates. So to make it easier for eligible children and teenagers to get immunized, we are supporting schools to provide immunizations at temporary in-school clinics. This is open to eligible students in grades 7 to 12, as well as teachers and staff. Clinics are running during and after school hours at schools across the province, and again, we strongly advise parents to take advantage of this program. More than 1,000 eligible students have already been immunized at these school clinics. Parents, please complete the immunization consent forms for your children as quickly as possible, because this simple step will protect them. If you have not yet been immunized, there are appointments or walk-ins for both first and second doses available at clinics, pharmacies, and physician offices across the province. Finally, I would once again like to thank all physicians and healthcare workers for your dedication, your tireless efforts, and for providing the very best care to your patients, even though I know you're exhausted and frustrated. Words just aren't enough to sum up how proud I am of all of you, so thank you so much. And back over to you, Lisa.
Thank you. We will now take questions from the phone and in the room here. We are on a tight schedule today, so please limit yourself to one question and one follow-up. Operator, could you please put through today's first caller?
Our first question comes from James Keller, Globe and Mail.
Hi, Dr. Hinshaw. Can you tell us how many schools in the province are currently on outbreak status that would have, I guess, 10% or more of the school population off sick?
Thank you for the question. I know that there is keen interest in school outbreaks, and we're working very closely with the Ministry of Education to finalize a reporting framework. I don't have the number in front of me in terms of how many schools have had that 10% criteria met. The school outbreak framework that was announced earlier this summer is being implemented in schools, where when a school identifies a cluster of a respiratory illness in a classroom or another setting that they find concerning, or if they hit the 10% threshold, then they call their local public health teams who work with them to do an investigation and put in any necessary measures. Again, I know that there is keen public interest in total numbers, and we are working with the Ministry of Education. We know that the changes that we've needed to make to our COVID-19 response over the past week need to be taken into account as we determine the final framework for reporting, and that will be coming soon. In the meantime, the local school community is notified if there is an outbreak, and that is to make sure that parents, teachers, and students who are a part of the school where there is an outbreak get that information, as it is locally relevant to them.
And did you have a follow-up?
Yes. What do you know about, like, in those schools, what is actually happening in terms of a public health response? Like, I've seen the framework, but for students and parents who are in these, the actual schools, what is different, about day-to-day life for them than would be in another school? I'm just wondering what is actually happening as these schools are reporting outbreaks.
We know that, again, part of some of the responses that would have been implemented in response to an outbreak are now implemented as a baseline enhanced measure across the province. And so some of the things that would be different from last week and going forward in schools that have outbreaks would depend in part on that local context. But it could be things like postponing extracurricular activities for a period of time, depending on what groups of children are impacted and where, again, whether it's children, staff, or teachers who have, and again, It's important to remember that a diagnosis of COVID-19 is not necessary, and what is important about these responses is that they look at the groups of people who have illness that's compatible with COVID-19. So it could be COVID or another infection, and the interventions such as postponing some kinds of extracurricular or out-of-school activities, perhaps implementing stricter screening protocols, ensuring that any children with symptoms actually have to complete a screening tool and not just kind of having taking it on faith that it's being done. Those are some of the options that could be put in place in those schools. But again, it really depends on the conversations between local public health and that particular school that's experiencing cases or respiratory illness in higher than expected numbers.
Thank you. Operator, could you put through the next caller, please?
Bill Fortier, CTV News.
Hi, Dr. Yiu. I'm hoping you can, pardon me, confirm this. What we're hearing is that, pardon me, at 90% of ICU capacity, that's when triage protocols are invoked. If that's true, and we have 350 beds available and we're at 89%, to me that means that if we increase the number of patients in ICU by 3.5 or, 4 patients, that means that we have hit 90% and triage protocols would be invoked. Is that true? And what would that mean?
Yeah, so in essence, I think what you're asking is about what are the triggers for some of the next steps or the next actions, and we're currently working on what that looks like. All I can say is that the capacity is very fluid. The capacity that I presented last week is very different from the capacity this week, and every day the teams are working so hard to create additional capacity so that we actually don't have to move to the steps of out of province or having to bring people into the province or, as a last resort, the critical care triage. So there is no definitive number right now in terms of that. We are, as I said, working on some proposals around what the triggers look like based on the expertise of our critical care teams. We are doing everything, as I said, to optimize and maximize capacity through different workforce models, but also looking at using different spaces that we don't traditionally use. So, for example, in the Edmonton zone, just yesterday, we're opening OR spaces to be potentially used as ICU spaces, and again, not traditional, not optimal, but definitely does have the ability to support an intensive care setting if required.
Bill,
I should clarify the question. Is there a number, is it whether it's 90%, 95%, 100%, there must be some kind of a number that lets you know it's time to bring in triage protocols, or is that call just is that a call that's made on the playing field where, someone just decided it's made? And for Dr. Hinshaw, I'm wondering if Alberta Health or Alberta Health Services is investigating rumors of this party in Edson and looking into it.
Yeah, so there is no number that I know of. We've never been in such a situation. So I think it's going to be best based on sort of the best advice and evidence that we can get from other jurisdictions, from our critical care leadership teams, and we're currently in discussions for that. And I'll pass it over to Dr. Hinshaw.
On the rumors of a COVID party where infection was deliberately spread, we are looking to see if there's evidence in any of our current data that would indicate there's been a greater than anticipated number of admissions, as well as looking to see if between our ministry or Alberta Health Services colleagues, if we know of any reports of such an incident. But I want to reiterate what I said earlier, that whether or not this particular incident can be verified, what's important to know is that this kind of action is dangerous, not just for those attending, but for those around them, and should not be contemplated.
thank you. Operator, could you put through the next question?
Michael King, Global News.
Hi, Dr. Hinshaw. Just going back to schools and students, why is this framework still being hammered out since we're already weeks into the school year, and how has the fourth wave changed how the province is approaching school outbreaks?
The framework that was announced last month is the framework that had been worked on over many previous months with education, and that is the framework that's being used. Over the last few weeks, of course, we've seen a significant impact of higher transmission, and so that has necessitated ongoing dialogue. Again, it's important that any adjustments to the framework are made and not constantly refreshed. So we don't want to be making changes every week. And so it's important that we land a final version going forward without having to create any kind of confusion for those involved. So it is something that is a priority. There are lots of discussions underway to determine what kinds of shifts may be required, if any, ensuring that we are, as was mentioned, implementing those additional measures that were put in place last week as robustly as possible, and ensuring that those baseline measures are the things that are going to be the most important in terms of preventing transmission. Because if someone is in school while infectious and doesn't know it, then the thing that's going to prevent ongoing transmission is that those are measures that are applied rigorously every single day, whether or not someone is known to have attended who's later diagnosed with COVID. So that is the number one priority, is the rigorous application of those universal measures, and any adjustments that may be needed to other interventions, such as reporting and what our public reporting framework looks like. Again, those are things that we need to make sure we land in a final way so that we're not making multiple adjustments if we can avoid that.
Michael, did you have a follow-up?
Yes, on post-secondary schooling, there's a letter out from a number of facilities that are asking for province-wide mandatory vaccination policies for post-secondary schools, one without an option to opt out, as well as province-wide universal contact tracing. Are those options on the table?
I would say for post-secondaries and vaccination, it's my understanding the current approach is similar to other settings where post-secondaries are required to implement additional measures such as mandatory distancing if they do not have a requirement for a proof of a vaccine program. And so similar to what we've done in other settings, the decision was made again that we would have universal enhanced precautions, mandatory requirements to minimize risk of transmission, and that those institutions that choose to implement programs that would mean that the majority of people would be immunized and those who aren't would need to be providing proof of these negative privately paid tests, that they would be able to be exempted from, for example, those universal distancing requirements. So that is the post-secondary framework that's currently in place. With respect to returning to universal contact tracing, it's important to remember that when we looked at that policy change earlier in the summer, and we looked at the pros and cons of moving away from universal contact tracing, many of the reasons that we moved away from universal contact tracing remain true. Considering the significant demands on the healthcare system, we know that the use of healthcare workers and the jobs they're deployed to is very important to consider that strategically. We are enhancing our teams. We've been working with Alberta Health Services to ensure that universal case notification, universal case investigation, and outbreak notification, outbreak management are our number one priorities. And those are the areas that, from a policy perspective, that will have the greatest impact on mitigating transmission. In terms of contact tracing, again, we know that one of the most significant locations of risk is the home. And we know that if an individual is diagnosed with COVID-19, they're able to communicate that to the people that they live with, and those individuals are able to then implement precautions such as, if they're not fully immunized, staying home for 2 weeks, as I mentioned earlier. And so, again, we're deploying resources to where the greatest impact is to be seen, and those are our current interventions that we're working on.
We have time for one more question, and we will go to the room. Please say your name and outlet.
Hey, it's Janet French from the CBC. I have some more questions about schools. So you've apologized for treating COVID as an endemic rather than a pandemic prematurely, but it seems like in Alberta schools that it's still, this framework still seems to be based on an endemic approach. There's no, in the letters home regarding outbreaks, they never use the word COVID. And there's no outbreak list, as you just addressed in a previous answer, and there's no requirement for Alberta Health Services to share case information with schools. So can you explain why parents don't have the right to know if there are COVID cases in their child's school?
Thank you for the question. Schools are a location that we have looked at, again, the evidence from other jurisdictions, our own evidence from our previous pandemic experience, what other provinces have reported. And what we see is that large-scale transmission in schools is not common, that schools are impacted by community transmission, but are not locations that drive community transmission outwards. And so our current framework that does not require mandatory quarantine, does not require close contact tracing, means that disclosure of individually identifying health information, as would happen if individual case notifications happened in schools, would be a violation of an individual's, again, privacy and their rights under the Health Information Act. So we do have that framework where schools, if they see that there are an increased number of children who are ill because of respiratory illness, again, or teachers or staff, they can work with Alberta Health Services. And in some ways, that is adding an additional layer of protection, because if individuals choose to not get tested for COVID but are home with an illness, they're now counted in the list as being part of that outbreak. And so it's less dependent on needing a test to be a part of identifying where there is an issue. We are, as I mentioned, working with education to determine if there are any adjustments that need to be made to this framework, but there are no other settings right now, aside from continuing care and acute care, as locations where there's a significant risk of transmission and severe outcomes if there should be an outbreak. In those settings, we are ensuring that follow-up takes place to mitigate and to manage outbreaks. However, in schools, again, we are taking the approach that an illness that fits that definition, a respiratory illness, is treated the same way, whether it's someone who's diagnosed with COVID or not, and that additional measures can be put into place. One of the things I would say is that what's been reported in other jurisdictions and reported in the literature about school outbreaks is the highest risk for large spreading events is when a teacher or staff who's infectious passes the virus on to others. And so it's critical that anyone who works in a school environment and any older children who are eligible for vaccine receive the protection that vaccine offers, not just for them, but for those around them, including those who they have the responsibility of teaching and caring for. And that's, again, something that I strongly encourage everyone working in the school system to take advantage of that protection that the vaccine offers.
Janet, did you have a follow-up?
Yeah, just picking up on what you said there, I guess I'm curious why not, if contact tracing is just too human resource intensive, why not use this stockpile of rapid tests if you're concerned about staff potentially having exposures? I understand that individual school boards, or a few of them, are kind of dipping in or asking for some are even paying for it privately out of education funding. Why not deploy rapid tests across the province in a way that parents could test kids at home, or teachers, staff, or school staff could use at home?
We have rapid tests that are provided through the federal government, and if schools wish to work with the Education Ministry to set up that program, there are tests available to be provided to them. The tests that we have, I know there are some tests that have been licensed for use at home. I'm not sure if any of those tests are ones that we currently have available. That's something I'd have to verify and get back to you on. But ultimately, we're not withholding rapid tests from schools. So if they wish to proceed with that intervention, again, that's something that we would be able to supply schools with those rapid tests to deploy. Again, not sure if that would mean at-home tests, but that is a resource that could be made available.
Thank you. That's all the time we have for today. We know that there are a few more people on the line who didn't get questions. They can reach out to the Health Minister's office or Alberta Health for follow-up. That concludes today's availability. Thank you for joining us and have a good evening.